Okay, so now it's 4. Let me get started. Hello everyone, welcome to today's webinar. I'm Suling Chang, and today I will guide you through the whole webinar process about partnership opportunities with Bayer G4A. First of all, let's just take a look of the plan today. At first, I will start from introducing you to let you to know a little bit more about G4A, who we are, what is our history, and what kind of record we have these years. And then I will guide you to know more about partnership opportunities with Bayer G4A this year. I will start from presenting some challenges that we would like to address this year, why we would like to find solutions to address these challenges, as well as what kind of criteria we are trying to find from the companies through our applications. Besides, I will also introduce you to know a little bit more about our application process. Last but not least, which is the most important part, and I think a lot of you guys also quite looking forward for that, which is our Q&A sections with our team member. We really encourage you, and please don't hesitate to type any of the questions if you have at the meantime I'm presenting. We will have all these answered by our team member in the Q&A sections. G4A aims at using digital health solutions to overcome currently some healthcare system problems in order to empower everyone to live a healthier and happier life. In order to do that, we also would like to accomplish equity, access, and sustainability. G4A job is mainly to build a bridge between digital health ecosystem innovators, which is you guys, as well as Bayer. In order to do that, we provide a broad range of partnerships, started from commercial partnerships to co-creation, M&A, late-stage investments. Besides, we also engage in early-stage startup investments. Okay, so now let me lead you to take a closer look of G4A history to know how we developed till today. Actually, G4A started from a Berlin meetup in 2012. And at that time, we established the cultural change model. We tried to connect biopharma with Berlin ecosystem. And finally, in 2014, we emerged to be the European first biopharma accelerator. In 2017, we established G4A, which will also launch our digital health partnerships as well as our own tracks. 2 tracks you can see nowadays, including Growth Track as well as Advance Track. Actually, we established them in 2019. In 2021, we launched G4A Strategic Digital Health Investments, which at that year, we also start making larger investments in our growth track as well as advanced track companies. Actually, last year, 2021, we reached a high global engagement and also have quite good record. As you can see now in our startup network, we have more than 3,000 companies across 62 countries. Within our 95 portfolio companies, we have 90% of them have quite good successful development. Besides, we also have a huge global community. Honorably, we also been named top 1 health tech accelerator program in Europe last year. Okay, so now I would like to introduce you to our 2 tracks. We are offering 2 tracks to partner with Bayer through integrated healthcare solutions in the digital space, Growth Track as well as Advanced Track. Let me first start from the Growth Track. We are more open to early to mid-stage startups, and it's more like an accelerator. And therefore, we are looking for a seed to Series A startups with minimum viable product with ongoing validation or published findings. For these kind of startups, we provide several benefits, including 100K plus euro investment in convertible loan. Besides, you also can enjoy our co-working space in Berlin. Last but not least, which is quite important, you will also gain access to our executed mentorship in Bayer experts and coaching opportunity from industry experts. Apart from Growth Track, we also have Advanced Track. and compared to growth track, it's more like commercial partnerships. And therefore, we are looking for Series A+ companies with published validation and clinical studies. Of course, you will have products on market, and therefore we are looking for traction with users or customers, or you have revenue. To be honest, actually, it really depends on what kind of company you are and what is the individual negotiation between your company and Bayer G4A. Because we provide a broad range of partnerships, started from commercial deal, co-creation. Besides, we also have joint venture as well as late-stage investments. Apart from that, you will also gain to be part of our networking group as well as have a great collaboration with Bayer. So now I would like to take you to the most important part, which is what kind of solutions as well as what kind of partner we are searching for this year. Actually, this year we have 5 main focus areas, including cardiovascular disease, mental health, women's health, radiology, and oncology. Let me first start from the cardiovascular disease. Under this challenge, we have 4 subsectors. The first one is lifestyle behavior change. In this challenge, we are mainly focused in the companies that can provide behavior change solutions. For example, like reducing progression of cardiometabolic disease such as hypertension. At the meantime, we are also interested in a company that can address risk factors of cardiometabolic disease. For example, like improving mental health and sleeping wellness, as well as smoking cessation. Next one, we have patient monitoring and digital biomarkers. For this challenge, we are mainly looking for the solutions and the companies that can provide patient monitoring, track disease progression, treatment effectiveness, or support the early diagnosis of the disease. At the meantime, we are also very interested in the companies that can provide digital biomarkers, for example, to predict the risk as well as acute event of the disease. Next one, we have social support. We are looking for the company that can connect people, either have the risk of having the cardiovascular disease or some of them already been diagnosed of having the disease to provide them some social support. Besides, we're also interested in a kind of companies that can increase connectivity for severe patients who suffer from the metabolic disease, cardiometabolic disease, and provide them some direct consulting and care coordination. Last but not least, which is the most important part and also is our new challenge, it is diagnosis and treatment of CKD. As we all know, CKD stands for chronic kidney disease, and it's a major risk of cardiovascular disease. And therefore, we are finding the solutions can facilitate diagnosis process. For example, like identify high-risk group of people of having the chronic kidney disease, or confirming the presence as well as the stage of the disease. Besides, we're also interested in the companies that can facilitate treatment as well as care procedure of chronic kidney disease. Okay, so now let me introduce you the second category, which is mental health. In this challenge, we are mainly looking for mental health and mindfulness solutions. We are very interested in the companies that can provide digital health solutions as well as platform to manage and improve the mental wellness of every individual. The other 3 categories, including women's health, radiology, and oncology, actually from our side is still ongoing process. So if you're interested in any of the challenge, please feel free to visit our website in the late stage of this year. You will find more information about that. Okay, so that's mainly all the solutions we are looking for this year. And if you can address to any of the challenges, please feel free to apply for that. We'll be very happy and willing to receive your application as well as to know more about your company. So now please allow me to tell you more about our application process. Actually, different than previous year, this year we are having an open cycle applications. It means that once you prepare, you can just simply hand out your application. And this open cycle application started from February 1st, 2022. which means that if you would like to, you can start applying for that. Besides, our application process also quite easy. It's only had 3 steps. First of all, you need to figure out what kind of track is really suitable for a company. Either is growth track or advanced track. If you are really not sure that which track your company suits to, then you can just simply click the option unsure, and we will decide that for you. And the next step is to review our website to reflect the challenge again, to feel like what is the real challenge that your company can really address to. If you figure out that your company can address to multiple challenges, actually it's even better. You just need to apply multiple of them. And the last step, which is the most important, is to go to our g4a.health/partnerships website. And on the top of the screen, you will see Join Our Portfolio, that button. You just need to click on it and it will take you to G4A Diligence portal. And then in that web page, you will see an Apply button. Click on it and it will jump out an online application form. And then what you need to do is to fill in all the information about your company. It will not take too long, actually. It will take about like 30 minutes. Okay, so that's all from my side. Now we are moving to the Q&A sections. So if you haven't put any question, please feel free to put it in the chat if you have any, because now we are going to invite Sophie and Bara to answer all the questions. And please start asking your question, and please allow me to now hand over to Sophie and Bharat. Thank you.
Thank you, Zuling. Okay, so we can start answering some of these questions. So first question, what stages of solution are we looking for? So a little bit on what Zuling touched upon, we're looking for early and late stage companies. With our growth track, we're looking at early to mid stage companies with a minimum viable product. And through the growth track, we look for early stage investments in these companies, mentorship, coaching, and then eventually it can lead to also partnerships. With our advanced track, we look at more late stage companies that have some form of traction with respect to users, revenue, and essentially these companies that are looking for commercial partnerships or co-development opportunities with Bayer. Next question, what type of business models are we looking for? Sophie, do you want to take this?
Yeah, sure. So we look at a wide variety of business models, and there's really not anything specific. I think a lot of the cardiovascular challenges that you recently saw in the previous slide, they're very much kind of B2C or like B2B2C. So we do look at everything from, solutions that support, workflow, but I think let's just talk about the challenges that you did see. So there are a lot more B2C. So currently I would say that, however, as you saw that we have several challenges that are still in progress. It could be that we look for solutions for employers, direct to payers, potential hospital setting solutions, or even solutions for, physicians. So really the business models that we look for are a wide variety, and there's not a specific one. It's just really based on the specific challenge that we have.
All right, so we have a question from Ashia. Do you consider pulmonary hypertension as a cardiometabolic disease? We do. It is a condition, and if you look at our CKD challenge and as well as our lifestyle behavior challenge, it's more broadly set up for conditions, cardiometabolic diseases, and conditions in that space. And most of these, like pulmonary hypertension, is also pre-existing and conditions that can lead to one of these diseases which we are actively tracking. So it definitely lies within the scope of cardiometabolic disease. What type of clinical evidence are you looking for with mental health solutions? Sophie, you want to take this?
Yeah, sure. So specifically, right now for mental health, we are looking at more of the we were looking at more of sort of the wellness space, so management of stress and anxiety. But in terms of clinical evidence, so we are speaking, so just giving you an example, we are looking at a specific company for mental health for postpartum depression. So usually it'll be clinical evidence within that specific sort of disease state. Most of the companies that we do speak to on the mental health side, if they're not more on the, I guess, wellness aspect, then usually we do require that there is published studies and findings. I think a company would be a bit too early if they were undergoing these studies. So usually we speak with companies with clinical evidence already, with potential trials that they have run or have found that their technology has some sort of a trigger with like the AI, for example, if that's what they're using. But that's the kind of clinical evidence we're looking for. So specifically trials and also as early as published findings, but usually we would require that it's in the market already. And so that's what we look for mental health solutions. But TBD to this year, we're still in progress of understanding exactly what we would like to look for. So just based off of last year, we were looking at a lot more, wellness, to think of, apps and platforms like Calm, for example. So it's not really heavy on the clinical side, but as we go more into depression, we are looking for companies that already have publications and validations in place. Yeah, and potentially, ideally, have either piloted or scaled with other partners.
Yeah, absolutely. And like Sophie mentioned, last year it was more broad in terms of mental health and mindless companies. This year, including that, we are also looking at mental health solutions that actively engage with the patient's inner circle, such as caretakers, friends, family, spouse, etc., that are involved in their care. So any kind of solutions that engage with them and include them in their solution is also of interest for us this year. We are a mental health company, clinically validated mindfulness that includes clinical validation in psycho-oncology. Apply for 2 tracks. We would really have to see a little bit more, Mark. But from the looks of it, it also depends on what stage you are at and what you're looking for in a partnership with a company like Bayer, for example. I would recommend including a track which you feel you suit the most, and we can, of course, it's not set in stone that if you click on the wrong option or apply for the wrong track, you'll be automatically excluded. There's nothing like that. If we see that your company would benefit rather from a different track, we will automatically process you within that track. So no worries there. What about medicine optimization, Sophie?
Medicine optimization? You mean like adherence or drug discovery? We don't necessarily look at drug discovery companies, but we do look at enhancement of disease states, or not managing disease progression. That's the way I should put it. Not enhancing of disease. That would not be ideal. And we also look at, I think there may be some challenges this year coming from potential adherence as well, specifically for Parkinson's disease. And so please keep a lookout for that. But I can't go any further than that because we're still in progress. So I hope that answered your question. Not drug discovery, but maybe adherence, maybe potential monitoring of disease progression.
Do you have any restrictions or preferences related to the location of the company? We are located in Colombia and our scope is LATAM. No, we do not have any restrictions in terms of the location of the company. We are looking at companies all over the world. In fact, last year we got applications from 62 different countries. What you see in our website in terms of the geographic region scalability is just the areas and regions where we'd like to eventually have our solutions on there. And as long as you have that in your pipeline and you plan to launch in one of those regions, we are definitely still open to looking at your company and partnering there. Are the challenges dependent on your existing drug portfolio? Sophie?
Yeah, so sometimes yes. So the challenges, it comes from a team called Integrated Care, and I know that we didn't really cover it earlier on, but this team is a team that we're a part of, and we are also responsible for actually building specific digital health products and solutions. And what's really interesting about this team is that really we can support our drug portfolio. However, we don't necessarily have to. So it can also be adjacent and non-adjacent. So some of the challenges that you will see, it's not really dependent on a specific drug or therapy area. I think the closest thing is we're dependent on therapy area. And so, Bayer is a big player in cardiovascular, and that's what we'll do. But it's not that the products and solutions we're looking for will support a specific drug portfolio. So I hope that answer helps.
Can you offer some examples of formats of commercial deals that came out of past applications? I mean, you can definitely look at our website for some of the news that comes out. We announce them, but in terms of commercial deals, Blackford analysis is definitely something that you can look out for in terms of press releases. This was a commercial deal, larger deal that Bayer signed. And we have not necessarily larger commercial deals, but we also have a lot of companies that sign pilots, for example, if they're not at the stage, sign a commercial deal, which eventually lead to commercial deals in terms of past applications. So there's a lot of companies that form that have come through G4A that have formed some form of partnership within Bayer.
Yeah, so we recently had one of our companies that was bought by Gluco actually in February. And so they actually published a study with the VentaStep team here for a PAD drug. That was an initial R&D pilot. As Bharat mentioned, Blackford analysis with they're working on a large data lake. That's all I can say. And then I'm sure you've seen in the news as well. So sometimes our early companies will come in and a couple of years later, we'll get a larger investment from Leaps. So one of our companies is called Metapad. Now they're called Huma, and they received a large amount of funding from our corporate venture capital to run a lot of different commercial activities with our organization. So, sometimes it doesn't happen overnight or even within 1 or 2 years, but Metapad came in, I think 3-4 years ago, and they closed a triple-digit $1 million round. So, everything from very small scale, pilots to validation studies, all the way up to, getting picked up by our corporate VC Leaps.
Also, what are the main criteria to be selected? In terms of criteria, it really depends on the challenge and the kind of company that we're looking for. Obviously, the main criteria, the top ones that we look for is the fit. How closely are you aligned and in position to solve the challenge, the healthcare challenge that's posted? And depending on the track, what would be if you're in the growth track, how differentiated you are in terms of your solution, the barriers to entry, how are you solving those? As well as your finances, your team. We look at your team as well, your experiences there. And also in terms of the advanced track companies, we look at your traction, so your revenues generated, your past partnerships, your existing and past partnerships, your users, active users versus passive users, if you're developing an application or a platform. So all of these metrics go into the criteria in terms of the due diligence that we do. In the mental health space, do the solutions have to be clinical or administrative solutions of interest? Sophie?
I would lean more towards clinical, just based on very early conversations that I've been having with some of the internal teams here. So they're actually looking for almost like digital therapeutics type of solutions for specific diseases within mental health. Oh, I think
We missed.
There we go.
Would changing lifestyle behaviors to lower injury risk and severity fit into your model? Injury
It would
risk.
depend. Lifestyle and behavior change is definitely something that's of interest to us, but specific to cardiometabolic diseases. I hope that helps. We're always looking for behavior change solutions to either prolong like a better state of living or to kind of extend sort of quality of life of a lot of these chronic patients.
Correct. And essentially, any solutions that are addressing these risk factors also of cardiometabolic conditions, like anything that's improving sleep health, that supports smoking cessation or improving mental health, etc. All of these solutions that are addressing those risk factors are also of interest in lifestyle behavior change. All right. Any further questions? So you can, as Zuling mentioned, you can definitely go to our website, www.g4a.health. And under partnerships, you can also find all of our challenges on our website. Whichever page you go, you can see on the top, there is a Join Our Portfolio button, which you can click to access the Diligence portal and start your application. There's also a CDA in place through the application that you sign. So we will be covered under a non-disclosure agreement. And that can also be set up through the Diligence portal. Oh, I have another question. We are a late-stage digital therapeutics company developing solutions to remotely monitor and manage NAFLD, which is a part of cardiometabolic diseases. Solutions include behavior change too. I presume we can apply for partnership. Thanks. Yeah, it looks like you do fit within the category of remote monitoring. I would definitely encourage you to apply. And if you're late stage, you're likely fit the advanced track. If we have a successful application, does Bayer require any ownership of the company or IP? Sophie, you want to take this?
So that really depends on the form of collaboration it is. So we would actually prefer that the company own its own IP for some of these commercial partnerships, but I do know that if it's a joint partnership or a co-creation where, you know, we would also be a part of creating that IP, then, you know, it would be discussed contractually. And so that most likely will be split in terms of IP holdings. But we would prefer if the company came with their own IP and we can just build on top of what you have. But if we do need to, you know, build together, it really depends on, you know, what that commercial partnership is.
We are developing a femtech medical device related to pelvic floor dysfunction. Would we be eligible to apply?
So we're currently not looking for anything regarding like pelvic floor. I think we're doing a little bit more of the mental health side of being a woman throughout her entire life. Whether that's postpartum, whether that's, you know, stress and anxiety management through menopause. If I would say it would be interesting if there was some sort of a connection to supporting women going through menopause, but if there is really no connection, then maybe not. But also we are looking for PCOS and endometriosis solutions as well. I shouldn't say that we are looking for it. It's in conversation. And so, you know, just something to keep in mind.
Yeah. What is the average duration of the program? What are the phases? We actually, this year is an open cycle. So what that means is we kicked off the program on Feb 1st, 2022, and it'll be open throughout the year. We will be looking into companies throughout the year that address any of the challenges. In terms of the phases, and of course, it's if you apply earlier, we can process it earlier, and we can take you to the relevant stakeholders earlier. So I would still recommend if you're at a stage ready to apply, I would definitely recommend earlier rather than later. And in terms of phases, there's definitely some internal due diligence phases that we go through. There's a number of selection phases that the company goes through, and this goes through in a period of 60 days. And you should definitely, if you've applied, you should be able to hear back from us in that period regarding your application and next steps, for example. Okay, any further questions?
Cool.
Also to just add, we also have, for companies that don't exactly fit within one of the challenges, we also host a pitch club event. That's the next one is going to be in May, early May. So the applications for that will be opening up in April. So keep an eye out for that. You can please follow us on our social media channels. We look at companies that any digital health company whatsoever through that event, where we look at companies and we select the winners that get to pitch their solution to our network in both internal and external Bayer employees. And I would highly encourage you to apply for that if you don't fit in one of those challenges. Apologies if this question was already cleared, but is there any limit for applications such as the region of the business location? Yeah, so there is no limitation in terms of which region you need to be based in. On the website, if you look at the challenges, there is one section where we look at the geographic region scalability. What that means is this is in line with our internal stakeholders strategy in terms of where they want your solution to be scaled in potentially. So as long as these regions like the US, EU, and Asia, for the most part, are main focus areas. So as if you have those within your pipeline where you want to launch your product, you should be fine. We are very interested in learning about you.
Great. And so, as you guys know, on our Diligence portal, it's an open cycle this year. And so, really, we're looking at companies 360 plus days a year. It feels more like 400 days a year, but so there's no deadline. It's an open cycle, and really what we're trying to do this year is to support whatever companies that do come in through even our growth track, to support them operationally continuously, instead of saying, you have to show up for 90 days and do X, Y, and Z. It's, we're very flexible. So, we're looking forward to seeing. A lot has changed in digital health, so we're looking forward to seeing that in your products and solutions. So drop us a note if you have any more questions, and looking forward to your profiles on the portal.
Absolutely. Yeah. So you can send us any questions if you didn't get a chance to ask us here to our mailbox info.g4a@bayer.com. We should get back to you relatively quickly there. So yeah, thank you so much for joining us today.